My name is Sandra Dejong, and I have been a child psychiatrist in Massachusetts and really worked as a clinician educator at Cambridge Health Alliance and Harvard Medical School. I started out my career as a high school English teacher, and in my ninth grade class, I had them all do journals, and every week I would collect their journals and read these heartbreaking stories of all the things they were struggling with. And, I would write comments back and then they would respond the next week. And I sort of felt like I was trying to be a therapist for, a whole class of kids. And so that was very important for me and working with kids in that way. And then, like many psychiatrists, I also grew up with a family member who had mental health issues and sort of bore witness to that growing up. And I think felt like that I had learned a lot from that experience, and I wanted to bring that to bear in helping other kids. I have loved my work as a child psychiatrist in particular because I have been able to see kids grow. And I've had the good fortune to have stayed in the same geographic location for a long period of time, and I have really seen kids move through their lives. And so I'm at the stage in my career where I've seen them going from really troubled small children or troubled adolescents to fully fledged adults. And I honestly, I can't think of anything more exciting than that. Since I'm an educator as well, I would also say that watching young physicians develop into child psychiatrists is also it's just an amazing experience. And I remember one time sort of sitting in my office thinking about our hospital division of child psychiatry, and every single service was headed by one of our graduates, and they were just 201 really fine child psychiatrists doing important work in a public sector system of care, and I felt really super proud. I think kids and the value of protecting and nurturing children has been paramount. I'm a big believer that kids are our future and that our world really depends on our taking good care of them and promoting their growth, their development. And that involves not just working on an individual level with kids and families, but also very much working in our communities and working in advocacy and trying to take on the systemic problems and challenges that we face. I guess as part of that, I also think that child psychiatry is fundamentally a collaborative undertaking, that you just cannot do it alone, and that in every case, you're working as part of a team and trying to really bring that team together and mobilize it effectively in the best interests of the child. I think it's so gratifying and it's so important. And I think as a system of care, I'd love to see us just continue to do more and more of that. And I guess the last thing I think of in terms of values is that while I'm a huge proponent of self-care and of personal professional balance, what some people call work-life balance, I have to say I think child psychiatry isn't a job. It isn't a 9 to 5 job. It's really it's something that you commit yourself to, and when you do that, I think it takes on its own gratification, particularly when working with others. It's just enormously gratifying. Yeah, so for me, being involved in organized psychiatry and the various societies and groups associated with mental health and kids has been unquestionably just one of the most exciting parts of my career. And so I would always encourage people to get involved early and to think about what they care about and how they would like to make a contribution. So everybody brings something to this work that is about them and their own particular passions, their own particular experiences. And there's just so much work to be done. And I think trying to harness your passions to what needs to be done is really the way to go. And I always encourage people to step up to leadership positions. They're enormously gratifying and challenging, and very much require sort of support while you're doing them. But they really allow you to feel that you are making a contribution and sort of moving the needle on improving healthcare for kids. So I've been involved in a number of organizations, ACAP certainly, on a variety of committees, ethics, and now climate change. I've been involved at the American Psychiatric Association, where I felt it was really important for child psychiatrists to have a voice in that mix. And I've been very involved in the educational organizations, again, really to try to keep the kids' voice on everybody's radar screen. It's, children they don't have their own voice. They are very much dependent on us to speak up on their behalf. And I see my role in all of those organizations as being critical in that particular way. To sound like a child psychiatrist, it was a developmental process. I started, as I mentioned, as a teacher, as a high school English teacher, and in that really fell in love with teaching. So I knew I loved to teach. And then I actually went off to journalism school and worked as a journalist, thinking I was going to sort of write about kids' issues, which is exactly what I did, and about family and kid issues. And I love to write, and then I sort of thought, I really want to be trained. So I I went to medical school to be really with the precise goal of becoming a child psychiatrist. And then when I heard there was a training director position available in my area, I thought, that's a really nice way for me to bring together all of my interests. And sometimes people look at my career trajectory and say, "Oh my gosh, it's all over the place. You've done all these different things." And I say, well, not really, because as a child psychiatrist, I'm still a teacher. As a child psychiatrist, I'm still a writer and very active in communities. And I also have this sort of clinical expertise that I can now bring to bear. So it's been a really great fit for me. And I think we're very lucky in child psychiatry that we can do a number of different things and express ourselves and who we are in a number of different ways and bring ourselves to bear in a really vital way to the work. So when I was the um, president of ADPERT, the Training Directors Organization, my initiative was around substance use education. And it was at a time, it was in 2018, and people were obviously very caught up in the opioid crisis. But we also knew that in addition to opioids, there were a lot of substances have been on the increase in at all levels, and also families were really being decimated by the impact of overdoses, and kids were being orphaned, and and sadly this continues to be true. And I really felt that psychiatry education needed to step up to help our trainees feel better equipped to deal with some of these issues. And the first thing I did was to reach out to people sort of across the gamut who uh, have expertise in various aspects of addictions, of pain, of education and to try to bring them together. And so we've done that, and we've worked with ACAP and APA and AAAP. We've also worked with the educational organizations to try to have an impact both at ADPERT in terms of educating membership, but also working with ACGME in terms of recommending changes to training requirements. And I love that kind of work, and I really feel like if we're going to make things better for kids and families across the country, that's absolutely the kind of approach that's needed. Um, so that's sort of at a meta level, but I also, at a much more intimate level, I have always had a peer supervision group, and I meet monthly with my peer supervision group, and we talk about challenging cases and share ideas and resources. And I love that. And for me, my child psychiatrist friends are such an important part of my life. And going to meetings like at ACAP that's really where it's at, that sort of camaraderie and mutual support, the joys, the hardships, the challenges, all of these things, to share them year after year with your colleagues is it's really such a wonderful thing. So I am a straight cisgendered woman. As you can see, I'm white, but I actually am an immigrant to this country, which is people don't generally know. I'm Canadian, and I came here, had to go through the immigration process that everybody else has to go through. And it was interesting because there were certain sort of cultural norms and expectations that I think I wasn't familiar with. And I also grew up in a universal healthcare system. So I had a very different system of care that I was used to. And um, so I've struggled, I think, a little bit with trying to understand the sort of focus on the individual and individual rights here in the US, and having come from a country where I think the social contract is more clear, the safety net is more clear. And so I think trying to bring what I value about the Canadian system to bear here in the US has been very much part of my experience. I also think as a woman, I came to medicine later in life, what they euphemistically call a mature medical student. And I had my first daughter in medical school and my second daughter in residency. And so trying to work in child psychiatry as a mother, as a caretaker of both kids, aging parents, a dependent family member, these are really challenging, I think, having all of these caretaking roles. And so I've really tried to help young women in child psychiatry think about their career trajectories and ways in which they can balance all of these caretaking roles. And I often say to them that you don't have to do everything at once. You can take things on sequentially, and that's okay. Um, and but I think we hold multiple hats as nurturers and caretakers, and that's important to address and to recognize and to sort of take care of ourselves around, and also be careful and intentional about how we take things on in our careers. Well, one very, personal one is that I had breast cancer at a certain point in my career, and that's always interesting. I think how do you as a physician and a caretaker manage your own illness? And I think it's sort of a metaphor for how do we as physicians manage our own vulnerabilities. And I'm glad that I think the world is becoming more open about physicians being more vulnerable or being as vulnerable as anybody else, and that people are being more outspoken about their own struggles with health and mental health issues. Um, I think it helps our young trainees to see that it's not that the generation that went before didn't have to contend with these things. There were different cultural expectations about how much you could say about it. But I think the openness is much healthier, and I encourage people as appropriate to be open and to get the support that they need. I was incredibly fortunate that I went to an international high school that was a scholarship-based school that was actually founded by leaders of World War II to try to promote world peace. And so I had my, adolescent years with students from all over the world. And I am so grateful for that experience because I think it made me realize that there are wonderful things happening in countries outside of the United States, that other countries have different kinds of approaches to healthcare and mental health care. And there are some countries, for example, for which children are an absolute value, and protecting and nurturing children is a cultural norm. And I thought, oh, that's really interesting, right? So, so I think that exposure has also shaped my career, and made me realize that sometimes looking outside of your local situation to a broader global context can be really helpful, and that things are happening around the world that we should, really pay attention to. Yeah, this is such a critical question. I'm a huge believer in something called the developmental mentorship network approach. So the idea that it's really never enough to have one mentor, that you really need a network of mentors, and the makeup of that network will shift over the developmental stages of your career. So I was just incredibly lucky that I had a wonderful training director in my general psychiatry training, and he's still a friend and colleague and mentor, and he really shaped what I viewed as mentorship and helped me sort of have a blueprint in my head of what I was looking for at different stages of my career. And so I've learned it didn't come necessarily easily to be sort of proactive about seeking mentorship, but increasingly I've come to recognize the importance of it, and felt freer about reaching out to individuals to ask for mentorship support. I think one of the ways I have actually most learned about mentorship is by being a mentor, and ACAP, I think, does such a nice job of providing mentorship experiences, for example, at the annual meeting. And I really think those are such great ways for medical students, residents, and ECPs to meet, more experienced child psychiatrists, and just really ask frank questions and follow up as needed. And those relationships are, really, um, to be Ericksonian about it, they're the ones that really give you the kind of gratification and generativity in your career that I think mid to end of career folks really need. So it's a vital part of what we all do. Gosh, I've been so lucky to have a family and friends that provide a ton of support. I also have been in and out of my own psychotherapy. I did a psychoanalysis when I was in my 20s, and have been in and out of therapy my entire life. And I hope people will be able to continue to have that kind of in-depth experience because I think it's just enormously helpful. Um, and I also think joining organizations and finding some place where you can feel comfortable raising concerns. And as I mentioned, I've been involved in a lot of organizations, and that's been just super helpful for me. Well, the first thing I want to say about that is that we have this expression work-life balance, and I actually have a bit of a problem with that phrase because I really believe the sort of old Freudian idea that work and love are critical to life. And as a child psychiatrist, I always say I would add a third thing, which is play. So for me, work, love, and play are the three core elements of life. And work can be rejuvenating and generative and regenerating, not just depleting. So I guess I just want to make a pitch for that. Um, but absolutely, loving relationships keep one well, and they are so important to sustain over time and not to neglect. And whether that's, family members or friends, uh, really to take time to nurture those is critical. And then the play, I'm a huge believer in adult play, and I do all kinds of things. I mean, I love to garden, I love to swim, I love to hike, I love to kayak, I love to travel, I love to cook, and these things are just they give you pleasure, they distract you from other things, they really contribute to wellness. And I hope everybody has something in their life that they love to do that has absolutely nothing to do with child psychiatry, because that's really, I think, going to be critical in sustaining wellness over a career. So I remember my child training director told me that I was really good at saying no. And at the time I was like, is that a compliment or not? And I like to think of it as a compliment. I think there are times when you should say no. And those times are really when you can't say yes and do a good job at it. Or if you say yes, it's going to take a toll in a way that isn't healthy, So at the beginning of my career, I said no to research opportunities. There were research opportunities in my fellowship that I didn't do because I had two children at home and a husband who traveled. And I was working really hard in fellowship, and that was taking up plenty of time. And I thought, I realistically don't think I can do this additional thing well and meet all my other responsibilities. So I tell people that, there are a couple of different ways of saying no. One is to say, no, I can't do it now, but maybe later, So if you still need people 6 months from now, I'd love to help you out, and sort of being positive about it. And the other is to sort of, if they're asking for your help, to help them problem solve and to help them come up with other ways of solving it. Because you don't want to be unconstructive. And in general, I think always being part of a solution is a really good way to kind of conduct yourself. And so rather than just griping about something or saying no, to try to sort of really come up with helpful ways of approaching it. In terms of taking a break, I think everybody should take breaks at certain points in their career. I took 6 months of maternity leave for each of my kids, and I took a medical leave when I had cancer. And I also took the summer off after I finished my child training. And Each of those have been incredibly useful times for me to think about where I wanted to head next and to appreciate things that I don't think I would have recognized if I had just been full tilt in my sort of daily grind of doing whatever work I was doing at the time. Um, and I really do think creativity is such a wonderful part of child psychiatry, coming up with good ideas, new ways to approach things, learning how to play again. All of these things are so valuable. And I think they really come with breaks and taking time away from it all. So I personally think it's a really useful thing to do. One is that I, it can be so stressful being an early career child psychiatrist, and there's so many things that at that developmental stage of life one is trying to do, right? Launch one's career, start a family often, maybe buy a place to live, enter a new community. I mean, so I remember being very stressed at that time of my career, and I wish someone had said to me, it's okay, it'll all be okay. You don't have to do all of things well all at once. And in particular, I think with kids, as child psychiatrists, we're very concerned about child wellness and we want to be the best parents we can be. And we're not perfect. And so I think realizing the resilience of kids and I remember turning to my kids when they were sort of teenagers and saying to them, do you wish that I hadn't had a career? Would it have, would it have been better for you if I hadn't become a child psychiatrist while you were little and then gone on to have a career in child psychiatry? And I have to tell you, they both say, absolutely not. We would always want you to have done what you did. We can't imagine you not working outside the home and being a child psychiatrist. And that's just such an important piece of who you are, not only as a person, but also as our mother. And so, if I had known that when I was an early career psychiatrist, I think I might have been able to relax a little bit more. Yeah, I have a lot of thoughts about this. So, I trained at a time when medications were really on the rise, and that was a good thing. They needed to be. We needed to think more about biological treatments for kids. I think we reached a point where the pendulum needed to adjust a little bit, and I'm really happy that we've kind of come back to our roots a little bit more, and I really think it is truly a biopsychosociocultural medical specialty, and I love that. I do worry about a few things. One is that I see a lot of young people going into private practice, and while I have always had a private practice as part of my work, um, I have always also worked in systems, and I hope we can find a way for our young child psychiatrists to continue to be part of systems of care, because that is so important in terms of moving the needle in child mental health in this country. And that, as we all know, really needs to happen. There is no, if anything, the need has increased in the last several years. The other thing I see is the uptake of telehealth, and I personally have been an advocate for that. I have worked with the ACAP Telepsychiatry Committee, and we developed a curriculum, and I'm a huge believer in telepsychiatry to improve access for kids and families to get mental health care. But I also think it's never going to be a substitute for in-person care, and I really hope that people who are doing telepsychiatry can find ways to also meet in person with their patients. Because I think if we lose that, we are really missing an important piece of the work. Um, And then I think the last thing is really around sort of the sort of population mental health approaches and helping people be involved in more meta ways through organizations like ACAP or through government agencies. Or through child advocacy organizations to really try to have an impact on kids' mental health systemically through policy change, through changes in reimbursement, in structures of systems of care. Those kinds of changes are really, really critical. And I think we have a long way to go in that regard. So I really, really hope we can find a way for it to be sustainable financially for young people to do all of those things and have a family, have a personal life, do all the things in terms of work, love, and play that I was talking about earlier, because we shouldn't be expected not to have those things. So I'd love to see a way in which child psychiatrists can play all of those roles and have a happy, healthy personal life as well. I would just say that at this time in our history where it feels like there are so many challenges globally, uh, and I think there's a real sort of yearning for meaning in life and for human connection, and for making a difference. I honestly think child psychiatry is a wonderful way to achieve that. I never go to bed at night thinking, am I doing anything with my work life? Is this a waste of time? I never feel that way. I always feel that to do anything to improve the lives of kids and families is going to make this world a better place, and I think the future world a better place.